Hello, I'm Dr. Bella, and you are probably watching the most important video in the whole mole check process. By now, you should be familiar with the order of examination to follow. In this video, I will delve into what to look for and what you need to upload for further medical assessment. If spotting troublesome moles were that simple, there would be no need for medical school or years of dermatology practice. But since this is a self-assisted mole check scenario, I will do my best to teach you how to identify suspicious lesions. Also, there are several case studies that you can watch towards the end of this section. When I examine a patient, I always start by asking them if they have anything they would like to show me, something new or growing or anything they find suspicious for any reason. If there is anything they wish to point out, you can apply the well-known ABCDE rule to decide whether to upload it or not. The same rules apply to any moles you come across during the mole check process. So what does the ABCDE criteria mean? A is for asymmetry. Does the mole have an axis of symmetry? Here are some images of asymmetrical moles. If you see anything similar, it should be uploaded for medical assessment. Also, here are some benign-looking symmetrical moles. B stands for border. Is the border uneven or broken, which are suspicious signs, or it's sharply demarcated or rounded, which are good signs? Here are some lesions with suspicious borders and some with benign borders. C represents color. Can you see multiple colors, most importantly dark brown, black or red parts within a mole? Here are some examples of suspicious color changes and some benign patterns. D signifies diameter. This one is tricky. Officially, a lesion should raise suspicion if the diameter is larger than 6 mm, but that's not always the case. I've seen many melanomas far smaller than that. So consider it a flexible guideline. If you spot anything dark with uneven borders, it should be uploaded for medical assessment. Here are some images to consider. E refers to evolution or change. Is there anything changing or growing? Or to put it differently, if an asymmetrical mole changes, it should also be uploaded. Change can be difficult to spot because it's usually so slow that patients miss it, but sometimes it can be obvious. Conversely, if there is something that's been there for a long time, and I mean 5 or 10 years or more, without any definite change, it's likely benign. Another broad but practical way to identify suspicious skin lesions is to look for the ugly duckling mole or lesion, the one that stands out from the rest. It's the outlier, the odd lesion. If most of the moles are brown, but there is one which is black or red, that's the outlier. Here are some images of ugly duckling moles. Whether a mole is flat or elevated, it doesn't matter. Only the previously mentioned rules apply. Lastly, I will talk about reddish, shiny or non-healing lesions. These might be covered with a scab that falls off periodically and may ooze or bleed. Sometimes they have shiny edges, can have some pigment, and atypical vessels that look like the branches of a tree. Here are some images of these types of lesions. So in a nutshell, this is what I can show you. It's best if both the patient and their helper watch this video several times before the mole check process. The more images and case studies you watch, the better you will get at spotting potentially dangerous lesions, and you might even save a life. Knowledge is power, or more precisely, its potential, which becomes power when you use it. I hope it helps. Thank you for watching.